Identify the structures 1 and 2. What is the peritoneal relation of each? Be specific. This is a parasagittal section of the body showing the abdomen. It is more deviated to the right. You can see here, this is the liver, the big part of the liver, the right lobe of the liver. Behind the liver, posteriorly, is a section in the kidney. You can see the cortex and medullary pyramids. And so one is the kidney. And then these are the loops of the small intestine. You can tell by the presence of the plicae circularis. They are more likely representing the jejunum, or could be the beginning of the ileum as well. It is not the duodenum. The duodenum will be more posteriorly located and higher located at this location. This location represents the beginning of the duodenum or the pylorus of the stomach. So these loops here, which show the plicae circularis, the circular folds in the mucosa and submucosa to increase the surface area of absorption, they represent the jejunum or the ileum. Now, during development, the abdominal cavity is lined with parietal peritoneum, which lines the walls. Parietal or parietes means walls, and parietal related to the walls. So the abdominal cavity, the walls of the abdominal cavity are lined with parietal peritoneum, but as the organs develop, they invaginate, and their invagination is to varying degrees. They invaginate into the peritoneal sac, and so they will acquire a peritoneal covering. This covering of peritoneum is called the visceral peritoneum because it is directly applied to the viscera. So they will push part of the peritoneum away from the wall. Some viscera, such as the stomach, the jejunum, ileum, which is represented in 2, the vermiform appendix, the transverse colon, sigmoid colon, and the spleen, are almost completely covered with visceral peritoneum. And the peritoneum will be reflected from the organ as a double fold of peritoneum. It could be called mesentery, it could be called ligament, or it could be called an omentum. But it is a double fold of peritoneum that suspends the organ from the abdominal wall. So in this sense, these structures are called intraperitoneal. So they are intraperitoneal in the sense of having a double fold of peritoneum, not in the sense that they lie in the peritoneal cavity. The peritoneal cavity is a very thin potential space that only contains a film of serous fluid. It does not contain organs, although some of the organs are called intraperitoneal. So number 2 is intraperitoneal. On the other hand, there are other structures which are called extraperitoneal or retroperitoneal organs, and they are only partially covered with peritoneum. They are not suspended from the wall by a double fold of mesentery. They are partially covered by peritoneum, usually on their anterior wall. If they are covered by peritoneum from the superior wall, like in the case of the urinary bladder, they are called subperitoneal. The kidney, which is shown here in number 1, is therefore a retroperitoneal structure, but it is called a primary retroperitoneal structure because a retroperitoneal organ such as the kidney, ureter, suprarenal gland, they protrude into the peritoneal cavity and they remain in this position in the adult. So they start as retroperitoneal, end as retroperitoneal, while there are other retroperitoneal structures which are derivatives of the gut, are called secondary retroperitoneal organs initially because the whole gut, the primordial gut, is intraperitoneal and is suspended into the peritoneal cavity by a dorsal mesentery. So as the organs grow, organs that belong to the gastrointestinal tract, then their posterior mesenteries, some of them might become gradually reduced and fuse with the parietal peritoneum. So they will have no more mesentery. An example here is the duodenum, which starts as intraperitoneal organ and then ends up to be mostly retroperitoneal. Only the beginning and the end of the duodenum are intraperitoneal. Same thing is true about the pancreas. Most of the pancreas is retroperitoneal except the tip of its tail. The same is true for the ascending colon, descending colon, but not the transverse or sigmoid.